I'm Philip Ward, Editor-in-Chief of Aren'tManyEurope.com, and I'm very pleased to have with me this morning Nicola Bedlington, who is very involved with an NGO based in Vienna and Brussels, promoting patient empowerment and patient involvement. I think a very important issue in medicine and becoming more important in radiology. Nicola, you were one of the participants at the opening press conference.
Yes.
There was some very interesting discussion, I think,
Yes.
during there. Could you tell us a little bit about that?
Yes, just a little about the European Patients Forum, just to get the context. We're an umbrella organisation representing umbrella disease-specific organisations at European Union level and national patient coalitions from each of the EU member states. And collectively we represent the interests of over 150 million patients diagnosed with chronic diseases. And it was great to participate for the second time at the press conference this morning. Very interesting. There was a really interesting intervention about the role of radiology with regard to diagnosis of prostate cancer. And what was especially pleasing from our perspective was the role of patient advocates in driving that change towards making sure that radiology is there on central stage in the context of that diagnosis. So that is very, very relevant and very tangible, and shows increasingly how patients could and should be involved in the issues at the heart of this Congress.
Excellent. Now, some radiologists will feel a little uncomfortable about that they're traditionally the doctor's doctor,
Yes.
reporting directly to a clinician, not communicating directly with the patient.
Yes.
What would you say to people who are perhaps a little reluctant to engage more with the patient?
Yeah. I think we're looking at a new era now. I think with the advent of new technology, with the acknowledgement that patients are not simply the recipient of care, but actually part of the healthcare solution, I think we're in a new era of communication and dialogue. Patients tend to be better informed, tend to be more health literate, and they're seeking information from the entire team, not just the GP or their specialist, but actually the entire spectrum of the healthcare team, including the radiologists. And they would like to know from the horse's mouth, so to speak, what the professional actually thinks.
Okay. But what would you say to a radiologist who thinks they're too busy, who has huge clinical workload and can't actually spare the time to communicate directly with the patient? What would you say to that person?
I would say it's an excellent investment of time. It's not a waste of time. Every minute spent talking directly to the patient will empower that patient to be able to understand further exactly what is wrong with them. The radiologist's expertise and input will help them ultimately in managing their own care at the end of the day. And quite often with our constituency, patients with chronic diseases, there are regular visits to the radiologist. It's not just a one-off visit, it's a regular relationship, and that needs to be fostered and nurtured and nourished.
But what if the investigation, the scan, is very, very complex and involves something that perhaps is out of the understanding of the patient? How could that be handled as where the radiologist has trouble explaining something very, very technical, very complex? How would you suggest that was handled?
I think that's one of the issues, actually, that the Patient Advisory Group is working with the Society on, in terms of looking at what is effective communication, how to communicate effectively to the lay person, to the lay patient. And I think it's a basic principle. Of course, it's highly scientific and highly complex, but at the end of the day, the health professional also has a duty, in a sense, to be able to communicate his or her work with the ultimate beneficiary at the end of the day. And
Good.
I think that should be part also of initial training, but also potentially continuous professional development as well.
I think it says a lot for ECR as an organisation that they're engaging in this way and involving you.
Yes.
It's a very positive trend.
And we see this relationship with ECR as a model for working with other congresses and other societies in a meaningful and effective way, because we're really being taken on board as a strategic initiative and involved in some of the strategic thinking around making the society much more patient-centred in its focus. We're working, for instance, with the audits and Standards Committee on developing a driver diagram on patient-centredness for the Society and obviously their multitude of members. And I'm very excited about how we'll take forward that in practical terms as well at the end
Excellent.
of the day.
Well, let's hope the process continues, and best of luck with it. And thank you very much for joining us here this morning.
Thank you. Thank you.